So let's discuss about hematopoietic cells. These cells are arranged in distinct niches within the vascular compartment of the marrow cavity. The hematopoietic stem cells are arranged in distinct niches within the vascular compartment of the marrow cavity. Erythroblasts constitute 25 to 30% of the marrow cells and are produced near the venous sinuses. They develop in erythroblastic islands composed of single macrophage surrounded by erythroblast in varying states of maturation. The macrophage cytoplasm extends out to surround the erythroblast. During this close association, the macrophages regulate erythropoiesis by secreting various cytokines. The least mature cells are closest to the center of the island, and the more mature cells are at the periphery. The location of the leukocytes development differs depending on the cell type. Granulocytes are produced in nests close to the trabeculae and arterioles and are relatively distant from the venous sinuses. These nests are not quite as apparent morphologically as are erythroblastic islands. Megakaryocytes are very large polyploid cells, DNA content more than 2N, that produce platelets from their cytoplasm. They are located adjacent to the vascular sinus. So in this diagram, you can see here. So these are the locations of various cells. Here in the endosteum, there is osteoclasts and osteoblasts. There are a lot of osteoblasts, whereas osteoclasts. Note the size and shape of osteoclast and osteoblasts. Osteoblasts are like cubicles, cubes, and only one nucleus is there. Osteoclasts are like different shapes and multiple nuclei are there. Hematopoietic stem cells will be just adjacent to the osteoblasts, and then adipocytes will be here. There is a blood vessel here. Just beside the blood vessel, lymphoid aggregates are there, granulocytic nests are there. You can see this is the megakaryocyte. Megakaryocytes and erythroblastic island you can see here. Uh, so this is the mega erythroblastic island. So that's why they are telling they are located adjacent to the vascular sinus. Cytoplasmic processes of megakaryocytes form long proplatelet processes that pinch off to form the platelets. Lymphocytes are normally produced in the lymphoid aggregates located near the arterioles, as you have seen that diagram here. Lymphoid aggregates, you can see this lymphoid aggregates. Okay, so what they are telling you, lymphoid located near the arterioles. Lymphoid progenitor cells can leave the bone marrow. Lymphoid progenitor cells can leave the bone marrow and travel to the thymus where they mature into T lymphocytes. Some remain in the bone marrow where they mature into B lymphocytes. If they go to the thymus, they will form If they go to the thymus, they will form T lymphocytes. If they go to the bone marrow, they stay in the bone marrow, then B lymphocytes. Some B cells return to the bone marrow after being activated in the spleen and lymph nodes. These are like honest B lymphocytes. They are what you called a paltu. So activated B cells transform into the plasma cells, which can reside in the bone marrow and produce antibodies. Bone forms a rigid compartment for the marrow. Thus, any change in the volume of the hematopoietic tissue, bone forms a rigid compartment for the marrow. Thus, any change in the volume of hematopoietic tissue, any change in the volume of hematopoietic tissue, as occurs in many anemias and leukemias, must be compensated for any change in the space occupying adipocytes. Normal red marrow can respond to stimuli and increase its activity to several times the normal rate. As a result, the red marrow becomes hyperplastic. The red marrow becomes C. Normal red marrow can respond to stimuli and increase its activity to several times the normal rate. As a result, the red marrow becomes hyperplastic and replaces the portion of fatty marrow. Bone marrow hyperplasia, an excessive proliferation of normal cells, what we call, accompanies all conditions with increased or ineffective hematopoiesis. The degree of hyperplasia is related to the severity and duration of the pathologic state. Acute blood loss can cause erythropoietic tissue to temporarily replace fatty tissue. Severe chronic anemia can cause erythropoiesis to be so intense that if not only replaces fatty marrow but also erodes the bone's internal surface, and in malignant diseases that invade or originate in the bone marrow, such as leukemia, proliferating abnormal cells can replace both normal hematopoietic tissue as well as fats. So this diagram is about osteoblast, how they will look. You can see the perinuclear halo here, perinuclear halo. This is just away from the nucleus. In the previous podcast about bone marrow and stroma, I told that there is a difference between plasma cells and these osteoblasts. In osteoblasts, there will not be uh, nuclear halo, perinuclear halo, but that was wrong. In the osteoblast, the halo will be there, but it is away from the nucleus. That is Golgi apparatus. You can observe that osteoblasts are like cuboidal and single nucleus, whereas osteoclasts, which are nothing but macrophages, they are aggregates of macrophages, multiple nuclei, different shapes. So this is just out of topic. Now coming to the topic main. In contrast, the hematopoietic tissue can become inactive. In leukemia and all tumor cells, the hematopoietic tissue can become inactive or hypoplastic, a condition in which the hematopoietic cells in the bone marrow decreases. Fat cells then increase, providing a cushion for the marrow. Environmental factors such as chemicals and toxins can compress the hematopoiesis, suppress the hematopoiesis, whereas other types of hypoplasia can be genetically determined. Myeloproliferative disease, which begins as a hypercellular disease, frequently terminates in a state of aplasia, absence of hematopoietic tissue in a bone marrow. Actually, this myeloproliferative disease, which will begin as hypercellular disease, then will come to the state of aplasia, absence of hematopoietic tissue in the bone marrow, in which fibrous tissue replaces hematopoietic tissue. In simple words, in myeloproliferative disease, there is proliferation of these cells initially, but then these cells are replaced by fibrous tissue.